And this one nice painful chicken Jimmy. Wait. Okay, honey. There should be another one here.
Jesus Christ.
Look at it. So him to they worried sick so that this dog I got one have more.
Keep it up two.
I put down 5. Kuba 5th one. Hey, wait.
I hear you.
Hello, this is Dr. Gospel, and the case you just saw is a case of Myiasis in a 4-month-old dog. It's an indigenous Nigerian breed of dog. All right. So, how do you diagnose this Myiasis? You diagnose it by seeing a pus-like lesion on the skin, but on application of digital pressure, you just see maggots will just come out from that skin. So how do puppies or the dogs, get this infection? They get in this infection mostly the puppies by, if you have a puppy that you've not bathed the puppy for a long period of time, the puppy is likely to come down with this Myiasis because it will now give room for flies to come and perch on it, and by so doing, they will just lay their egg. And if there is any cut or if there is any injury on the skin of this dog, the egg that is deposited by this fly will now find its way to the skin. So in the skin, they will now, undergo some metamorphosis where maggots will be formed and it will be causing this Myiasis. This type of Myiasis that we saw on that skin, on the skin of that animal, of that dog, is type of Myiasis we call cutaneous Myiasis. There's also an visceral Myiasis, but this one is just a cutaneous Myiasis. For the visceral one, you don't see it. It is found inside, the intestine, inside of the body of the animal. But this one is just, restricted on the skin. So how do you treat this Myiasis? For you to treat this Myiasis, of course, that what I just did was just to give ivermectin, because ivermectin seems to be the drug of choice against Myiasis. All right. So you give ivermectin. Mind you, ivermectin has a very slim safety margin. The safety margin of ivermectin is very, very slim. So if you are giving ivermectin, you must make sure that you don't overdose, because if you overdose your ivermectin, the animal is going to come down, with ivermectin toxicity, and that will lead to the eventual death of that animal, of that dog or animal after all that you are giving that ivermectin. So what I did, because of the size and the age of the puppy, I gave 0.2 mils of ivermectin through the subcutaneous route, because that is just the only safe route for ivermectin administration. So I gave 0.2 mils. Then I now watch for the adverse effects of the drug ivermectin, because it has some adverse effects if you overdose. So I waited for like 20 minutes before I left the scene, right? So I waited for like 20 minutes to see if the dog will come down with some ivermectin toxicity, or toxic effects. And if that happens, the drug that I will just give an antidote to that ivermectin, and the antidote that I will give will be atropine. But it did not happen. All right. So if you give ivermectin and you notice some toxic effects of the drug, you can give an antidote, which is atropine. The antidote of this ivermectin is atropine. So you can give atropine, and the animal will just come back to normal. All right. Thank you for watching.